everyone. Welcome to our first Med and Ed interview. I, Roshni Danga, will be your host, and today I will be representing Med and Ed. Joined with us today is a special guest, Dr. Ihsan Kaadan. And before we get started, I just wanted to thank you for taking the time out of your busy day to be here with us today. That being said, let's jump right in. So how are you doing today, Doctor?
Good. Thank you for hosting me in this. And it seems like it's really interesting, to see your organization and all the work that you guys are doing.
Mm-hmm. Yeah, and okay, so just to kind of give an overview, today's discussion is mainly revolved around the doctor's aspect on healthcare. However, I first need to quickly address the elephant in the room, which is COVID-19. As of now, the infection rates are spiking and it looks like a second wave is imminent. So, doctor, how's the situation on your side?
I mean, currently now, like as you hear from the news, like the cases numbers are rising here in the U.S., in Massachusetts in particular, and all over the world, obviously. Even in my back home country in Syria, also the number of cases are rising significantly, actually. So we kind of see this second wave, and that was actually expected that we're going to have like this second wave. But there is a lot of optimism that, with the news related to the vaccine, hopefully we can control this pandemic very soon.
Yeah, hopefully, yeah. Yeah, and would you like to tell the viewers a little bit about yourself, like your profession, how you came about pursuing, a job in the medical field?
Sure. So I actually, I'm originally from Syria. Um, I went to medical school over there. I'm graduate of Aleppo University Hospital, where I got my training, but where I studied was in Aleppo University Faculty of Medicine. I did 1 year of training over there, as I said, in Aleppo University Hospital. Then, because of the situation got complicated in Syria, I decided to come here to the US to pursue advanced medical training, and I continue my career in medicine. But actually, since I was a high school student, I always wanted to be a doctor, and that's why I chose, to go to medical school after high school. And I don't know if everybody knows that, but it seems like it's a different system than the US. So in Syria and like other parts of the world, actually, you go to medical school right after graduation from high school. So you don't need to do undergrad and then grad school.
Oh, okay. Oh, I didn't know that. So thank you for telling us. And I am fascinated by how doctors, take the extra mile to help people while risking their lives. So again, thank you so much for what you do. And we're all appreciative of this, especially in these unprecedented times.
Sure.
Yeah, so would you like to share your experiences in the medical industry, for example, how being a doctor impacted your life personally?
Right. So actually, as I said, after graduation, I moved here to the US. I did some looking and observing the health system here in the US before I joined my current medical training program. I also did masters in in international health policy and management here in Massachusetts. After that, I went to do some research in cardiology at Mass General Hospital, one of the teaching hospitals of Harvard Medical School. And then after that, I joined the internal medicine residency program here at Boston Medical Center. And that's the teaching hospital of Boston University. So I mean, it's really busy to be a doctor, especially during training. I used to have a lot of things to do before joining medical school. That's including, research and like working and volunteering in field of public health. But it's always rewarding, to be a doctor treating patients, especially during this pandemic, although it has been stressful in the past like I know since March when everything started here in Massachusetts, but it's like rewarding when you talk to patients, when you see them that they got the treatment that they need and like when they improve. So it's really good feeling actually. And there are, as you know, different type of fields in medicine. So currently, what I'm doing is internal medicine. Uh, that we don't do surgery. That's obviously different than this than surgery. So we don't do surgery. We do some procedures, but not like a surgery per se. So that's different, and that makes our lifestyle uh, maybe uh, it's really personal, but in my opinion, I feel it's better than like spending most of my time doing surgery. That takes obviously more time actually.
Mhm. Yeah, that's really great to hear. So, moving on to like the gist of today's discussion, what's your opinion on healthcare accessibility in places you've worked before? Have you experienced it or seen it like firsthandedly in places that don't have proper healthcare? Would you like to share your experiences about it?
So it depends actually. For example, in Syria, um, we sometimes it's challenging to have healthcare accessibility, just like in the remote area or like in the suburb, compared to the people who are in the city. We do not have like here to the U.S. like an insurance system,
Mhm.
but actually there are hospitals funded by the government, so people can just like show up. Whoever in Syria, either you're Syrian or not Syrian, you just show up to the hospital, you get the treatment you want.
Oh,
So in terms of the accessibility, it's better in the cities, as I said, compared to other places. Uh, but unfortunately, that the situation changed since 2011 because of the pandemic. Um, and I mean because of the conflict. I'm sorry, but I mean it got worse because of the pandemic in Syria.
yeah.
However, here in the U.S., um, like we adapted because of the pandemic. For instance, um, we are more dependent on telehealth, so patients they don't need to come to the clinic in person, for example, to be seen or like to talk to their PCP. We can manage many things over the phone. For example, if patients need a management or like titration for their blood pressure medication or for insulin for their diabetes medication, we can obviously do that over the phone if they are able and if they have access to check their blood pressure and blood glucose. I mean, excuse me, I'm putting this mask just because I'm in the hospital library.
Yeah, it's completely fine. I understand. And so let's move on to the biggest predicament the world is facing today, COVID-19. So how, as like you medical professionals, been impacted by COVID-19? I know you kind of talked about it already, but like maybe go more in depth so the viewers can kind of have a chance to step
Sure.
in your shoes.
Sure. I mean, it's really a different dynamic.
Mhm.
The reason for that, I remember like back in March, April, and May, I spent a lot of time, kind of 100% of my time treating COVID patients. The reason it's difficult, just like people, get sick very quickly and like kind of might deteriorate quickly compared to other conditions or especially flu, for example. And we see this turnover, like with the clinical status, like between the day 8 to 12, kind of to be more specific around day 10, they
Mhm.
turn quickly. And for example, if somebody doesn't require oxygen, you feel that all of a sudden they need oxygen to breathe. Uh, the other thing, actually, so this is the critical change in their health that was important. The other important thing is like the PPE. So before you see the patient, obviously you need to gown, like to wear all the PPE. That takes more time actually, uh, and kind of it's kind of another barrier for work because, as I said, it takes more time, like to go and enter to the room and like see the patient. And as I kind of mentioned before, um, we're doing less in person as an outpatient, or we see those patients in person in the clinic, and instead we are depending on telehealth, either Zoom or like what just like call them over the phone. So kind of those like changes and shifts we did over the past few months because of COVID.
COVID-19 definitely has impacted like the accessibility to healthcare. So can you like explain that a bit? Like, because some people can't, like you said, can't, meet the doctors in person. So
Sure.
there's like a lot of diseases that are neglected because of COVID-19. So can you, explain that?
So yeah, so some people actually they obviously afraid to get out from home, take the public transportation. I'm talking here in Boston because many people depend on public transportation. Uh, they don't want to come to the hospital. They become exposed to COVID, and that's especially true in the very beginning when masks were not recommended for everybody. As you remember, the recommendation initially was like people to wear like the people who work in healthcare should wear the mask and not everybody. And obviously that's changed over time. So recommendation now everybody needs to wear mask.
Mhm.
So so at that time actually we see less people are interested to come to the hospital and like see their doctor in the clinic because they don't want to be exposed for more COVID. So that's again like decrease the accessibility and like less people got seen in the clinic. And as you know, people are sitting around, not exercising as they used to be, not going to the gym. That's actually made the chronic diseases worse
Mhm.
in terms of like gaining weight. And as you know, that gaining weight affect the diabetes in general and the hypertension. Those people kind of if they are not monitoring if they don't monitor their blood pressure, for example, or diabetes or PCP check on them on a regular basis, obviously they kind of affected by the pandemic.
Yeah, I completely agree. It's definitely like COVID-19 has definitely made it really hard for like all of us, in fact.
Right.
So yeah, and do you think that we are receiving like an adequate amount of information about COVID-19, like how um, how to protect ourselves from the virus and stuff like that? Do you think that we should receive more information from like medical professionals about how to protect ourselves?
Um, I think people really need to understand that it's really a serious pandemic. People really need like to take things seriously to avoid gathering. All those like recommendations made by CDC. I think uh, at some point now, or like during this time, we have more data, more information to know about the pandemic, and like this information almost available for everybody, like on the internet, on the TV. I think what we need now is compliance with those. You know, avoid like social gatherings, especially now we're heading uh, toward like holidays, Thanksgiving, Christmas, and New Year. So I think we need to particularly pay attention on compliance
Mhm.
uh, more than like any time before, especially like during this like transition. I mean, between now and until the vaccine become available for everybody.
Yeah, yeah, I completely agree. I think that a lot of people are neglecting the things that the health officials have, placed, and like, a lot of people are not wearing masks, especially in like the villages because it hasn't been, explained or emphasized in like enough for them, like, you know. So,
I think it's very critical to communicate that with the people about the
yeah.
mask. Very, very important. I know that at some part of the world, it's like not everybody can afford a mask, but I mean, people got alternatives to use, obviously, than masks.
hmm Yeah. So, like I was saying, like in underprivileged areas, COVID-19 was a big hit, and also they a lot of people don't wear masks because they think it's not important, and COVID-19 is like nothing, it doesn't really matter. So do you think there's any way to help them understand, or even like help them regarding healthcare accessibility that we can do as citizens? Or
Sure. I think one of the key and very important measures we should take, all of us, is wearing a mask. Uh, that's to protect ourselves, to protect other people, from transmitting the diseases. Uh, Probably at this time, like as a young people, uh, we might get sick and infected, but not to the level and the seriousness as of the older people. And if I don't like, if like we see like low number of people who die in a young age compared to the older age, that does not mean we should not be compliant with the mask. Because
Mhm.
what we want collectively to protect ourselves from this pandemic. I think I cannot emphasize more how important is wearing the mask.
Yeah, I completely agree. All right, so I've asked a lot of questions already, and so this is a lot
Yeah,
of
please.
fun. So are there any organizations that people can donate to help with COVID-19, or helping underprivileged areas specifically?
I think everybody of us like has a community.
Mhm.
Um, I think we should look around us to see if there is a local community. I'm talking like here international. I'm not talking in the U.S. and I can move later to the U.S. I think we can all look around about local organizations and like try to support them uh, in like a PPEs, in a mask, or even like donating like money to them. I think that's very critical to collectively work together.
Mhm.
Like here in the US also, I remember in the beginning of the pandemic, people really uh, spent like a lot of time donating from money and effort and like their time, like to help the healthcare providers, fighting this pandemic all
Mhm.
together in a way that they actually managed and like help to assemble the face shields so everybody can get more protected for
Mhm.
that. Also, they donated food, um, like support as well. Like even this support, even like if people like are not, they don't have the money or like they don't have the capacity to help, like financially, they just can support and like raise awareness about this pandemic. Actually, I think that's the most important thing. Like to encourage each other, how to protect ourselves and to protect the other people. I think that's the most important take home message, and help we can help the healthcare provider with.
Yeah, I completely agree. I think that um, the best thing we can do is kind of work together to kind of, raise awareness about how important this virus is, or like how important it is to social distance, wear masks, and
Sure.
stuff like that. So, yeah, so that is everything that we have to discuss today. So, that is Dr. Kadan. Everyone, thank you so much for being here today. I wish you all the best, and please, please stay safe. And we have like a lot of COVID cases already. So, yeah. Thank you so
Thank you so much, and I
much.
really encourage you and everybody to take care of themselves, and and it's really great work what you are doing and like raising awareness about COVID. Thank you for having me.
Okay, thank you.